Welcome, health advocates and community members, to an exploration of post-exposure prophylaxis (PEP), a powerful tool for HIV prevention, particularly for communities of color. Join us as we delve into the significance of PEP, its effectiveness, and the importance of equitable access for marginalized communities. The HIV landscape in communities of color. Despite significant advancements in HIV prevention and treatment, communities of color continue to face disproportionately higher rates of HIV infection. Disparities in socioeconomic status, access to health care, and stigma contribute to these disparities, making it crucial to address these underlying factors while expanding access to effective prevention strategies. PEP, a shield against HIV infection. PEP, or post-exposure prophylaxis, is a preventive medication regimen that can significantly reduce the risk of HIV infection after potential exposure to the virus. PEP involves taking a combination of antiretroviral drugs within 72 hours after potential exposure, ideally within 24 hours. The effectiveness of PEP. Clinical studies have demonstrated that PEP is highly effective in preventing HIV transmission when taken correctly and promptly. Studies have shown that PEP can reduce the risk of HIV infection by up to 90%. Why PEP matters for communities of color. PEP offers a critical safety net for people of color who may be at increased risk of HIV exposure due to various factors, including higher prevalence rates of sexually transmitted infections (STIs) in certain communities, increasing the risk of HIV transmission. Limited access to pre-exposure prophylaxis (PrEP), a daily preventive medication, due to socio-economic barriers or healthcare disparities. Experiences of stigma and discrimination that can hinder access to HIV testing, prevention, and treatment services. PEP accessibility for equitable prevention. Expanding access to PEP for communities of color is essential for achieving equitable HIV prevention and reducing disparities in infection rates. This requires community awareness and education, raising awareness about PEP and its effectiveness among communities of color to empower individuals to seek timely prevention if needed. Overcoming socioeconomic barriers, addressing financial and logistical challenges that may hinder access to PEP, such as providing financial assistance and transportation support. Culturally sensitive healthcare, ensuring healthcare providers are culturally sensitive and understand the specific needs and concerns of communities of color regarding HIV prevention. Integrating PEP into comprehensive prevention strategies. PEP should not be seen as a standalone prevention method but rather as an integral part of a comprehensive HIV prevention strategy for communities of color. This comprehensive approach should include promoting PrEP as a primary prevention method for those at high risk of ongoing HIV exposure. Encouraging regular HIV testing to detect and treat infections early. Addressing stigma and discrimination associated with HIV. Expanding access to comprehensive sexual and reproductive health services. Empowering communities for collective prevention. Community engagement and empowerment are crucial for ensuring equitable access to PEP and achieving effective HIV prevention for communities of color. This involves community-led initiatives, supporting community-led organizations and healthcare providers that can provide culturally appropriate and accessible PEP services. Peer-to-peer education, empowering individuals within communities to share information and support about PEP and HIV prevention. Advocacy for policy change, advocating for policies that promote equitable access to PEP and address systemic barriers to HIV prevention. PEP, when combined with comprehensive HIV prevention strategies and community empowerment, holds the potential to significantly reduce HIV disparities among communities of color. By prioritizing equitable access to PEP and addressing the underlying factors that contribute to HIV transmission, we can work towards a future where communities of color are free from the burden of HIV.